My name is Alexandra Blacka. I'm going to be performing a secondary piggyback IV med today. I usually have my badge on. I apologize, I misplaced it. Okay, so the first thing I'm going to be doing is checking my physician order in the EMR. So for Mrs. Betty Jones, the doctor has ordered Rosefin 1 gram IV due to her white blood cell count being elevated. Basically, we have available Rosefin 500 per milligram per ml. So I'm going to check the integrity of the vial and everything. And it's basically 1,000 divided by 500 times 1, so that would give me 2 mLs. I know that Rosefin is to treat and fight bacteria. Recommended dose IV is 1 to 2 grams daily. Side effects are GI upset, serious side effects, anaphylaxis, Stevens-Johnson syndrome, seizures. Contraindications would be if the patient was allergic to peptin, penicillin, or milk protein. I'm going to be infusing this over 30 minutes. And basically my bag that I have here is 50 mLs. So I know we're going to be infusing it over 30 minutes. So it would be 50 divided by 30, and the drop factor on here is 10. So that would give me 17 drops per minute. Okay, so now I check the patient's labs, allergies in the chart. I'm going to wash my hands and draw up my medication. So I'm gonna put on clean gloves. Checking the integrity again, making sure it's not expired. I'm going to use aseptic technique, cleaning that. All this would be freshly packaged, so I know I need to draw up 2 mLs. I'm going to draw up air. Scoop method. Okay. Now I'm going to be injecting it into the saline here, so I'm going to clean. Check it again, I would check the integrity of that. Inject my medication straight into the sharp spin. I'm going to shake it up to mix it up. I'm going to label it with, do we have tape here? I would have my tape ready. I'm just going to pretend, but I would label it. I'm going to put my initials, date, time, the type of antibiotic, the dose, the patient name, the room number, and my start time, which I'll do after in my initials. So now I'm going to check the integrity of my tubing. I've already done that. I'm going to label my tubing as well with the date, the time, and my initials. So I'm going to gather my supplies and go into the patient room. I'm going to remove my old gloves and wash my hands before I do that. Mrs. Jones, I'm Alex. I'm a student nurse. The doctor has ordered for you Rosefin, which is an antibiotic, which we're going to hook up today to hopefully reduce the inflammation and get rid of that infection. Can you please confirm your name and date of birth for me? And can you tell me if you have any allergies to penicillin or anything? No? Okay. I'm going to wash my hands and put on clean gloves. Okay, so the first thing I'm going to be doing is checking for any phlebitis or infiltration. Does that hurt? No? Okay. I'm going to, we know that's already running at 17 drops per minute. I'm going to go ahead and stop, clamp that, and I'm going to hang my secondary. So, okay, I'm going to spear and put my tubing attached. I'm going to prime it, make sure that's stopped so we don't lose any of their medication. Make sure there's no air bubbles in it. I'm going to hang this. That would be labeled. I'm going to drop down the primary. I'm going to stop my primary. I'm going to clamp that. I'm going to clean my ports with alcohol. I'm going to attach this and unclamp. I'm going to fill this halfway. I'm going to ensure that it's running correctly, 17 drops per minute. Okay, that looks good. I'm going to unclamp here. I'm going to check my site again for any infiltration. How are you doing? Okay. So we got that all set up, Mrs. Jones. I'm going to come back in 30 minutes. I want you to call me if you have any pain. I will come back and check for any allergic reaction. I'm going to document the procedure, the medication dose, frequency, routes, my name, patient's name and date of birth, any allergies. I'm going to document the procedure, how they tolerated it, and also any patient teaching. So now I'm going to take off my gloves and wash my hands. So now we're going to assume that 30 minutes is up, and I'm going to make sure I'm check the patient's chart again. I'm going to knock. Mrs. Jones, it looks like the Versephin, your antibiotic, is finished. So I'm just going to stop that for you. Can you confirm your name and date of birth? Okay, good. So what we're going to do now is we are going to clamp it, which it would be empty. I'm going to take that off. I would dispose of that properly according to the policy. I'm going to put this back up. I'm going to, and this would have been unclamped. Make sure it's unclamped again. I'm going to make sure that that is running still at 17 drops per minute. I'm going to come over here and check my site again for any phlebitis. How are you doing? Okay, I'm going to document that the infusion has finished. Again, the drug dose, route, any complications, and if they tolerated it. If there were any allergic reactions, I would notify the doctor and document that.